Hi, we're Group 13, and we're going to be talking about why we disagree with mandating genetic profiling in minors. So, the use of this technology of children and minors has immediate implications. The immediate implications would be that there could potentially be a conflict of interest, and because they're a minor, probably the parent would have the ultimate say, and there could be conflict of interest in what the parent sees best for the child versus potentially what the child wants. Also, there are challenges of interpreting data. The first challenge would be transitioning from hybridization techniques to Sanger sequencing. The second challenge would be distinguishing between pathogenic variants versus rare polymorphisms that can lead to variants of uncertain significance. And the third challenge would be clinical associations. There is a lack of sufficient data on clinical associations, which can lead to difficulties in interpreting variants. The fourth challenge would be the lack of direction. These tests could lead to unintentional findings that are unrelated to the indication for testing. And the fifth challenge would be false indications, as genetic test results have the potential to be misunderstood and cause harm for instances of false negatives, false positives, or an overinterpretation of a carrier status. And lastly, the sixth challenge would be hitting a wall. With our evolving knowledge and understanding of the complexity of the human genome, these issues may only become more difficult to overcome. Basically, pharmacogenomic genetic data can't account for all the variability in drug responses. In newborns and infants, enzymes could be metabolically immature, which can lead to clinical outcomes different from what was predicted from testing. Also, there is an ethical concern of mandating pharmacogenetic testing in adopted children. About 2% of the children in the U.S. are adopted, and parents looking to adopt a child may want to ask for the genetic profile of the child and make their decision based on that. And this can lead to increasing the potential for child discrimination just based on these genetic profiling and causing a pool of unwanted children that are unadoptable because of their genetic profiling. Ultimately, we feel that patients should not be mandated to undergo genetic profiling by the age of 18 simply because lack inconsistent efficacy and results with pharmacogenetic-based therapy, sensitivity with acquiring pharmacogenetic data, and vulnerability of adopted children.